How to conduct CPR. As previously stated, CPR stands for cardiopulmonary resuscitation, CPR, and is the globally accepted procedure to promote circulation and breathing in a casualty. This will typically take place immediately after an emergency accident or cardiac arrest. It is an easily learned process designed for first aiders or bystanders to provide an extension to well-being whilst emergency services are in transit. It combines artificially induced breathing along with rhythmic chest compressions. This should encourage blood circulation and oxygenation and will allow the brain to continue to function as near to normal as possible until medical equipment and professionals are on site. How to conduct CPR. To perform CPR, take these following 6 simple steps. Shake and shout. Approach the casualty carefully after checking the area for risks or danger. Assess the responsiveness of the casualty. Gently shake their shoulders for a reaction or loudly ask if they're okay, hence shake and shout. If you are alone, shout or ask for assistance, but don't leave the patient. Check breathing. If a casualty is suffering a cardiac arrest, their breathing will not be regular or constant. Keep their head back and look or listen for regular chest movements and audible breaths. Do this for approximately 10 seconds. If they appear to be breathing normally, put them in the recovery position and monitor them. If the casualty is not breathing normally, continue with the following steps. Call emergency services 999 or 112. Either organize a call or ask someone else to do it. There should be no delay if possible. Also, ask if a public access defibrillator, PAD, is in the vicinity. Chest compressions. Kneel next to the casualty. Put the heel of any hand in the center of the casualty's chest. Put your other hand on top of the first one, interlocking fingers as you do so. Keep your arms straight and push down on the chest by a depth of about 5 to 6 centimeters. It should be a smooth, strong action. Do about 2 of these compressions a second. Rescue breaths. After about 30 compressions, start to give rescue breaths. These are performed by tilting the head back, pinching the nose closed, sealing your lips around the casualty's mouth, and breathing out strongly. This should be performed twice, and if successful, the chest of the casualty should move up and down. It should take around 5 seconds to perform both breaths. Repeat. Continue the process of 30 chest compressions and 2 rescue breaths until emergency services arrive. How to use an AED. An AED is an automated external defibrillator. The equipment is designed to be an easy way for a first aider or medical professional to deliver a shock to the sufferer of a cardiac arrest. It delivers a short electric shock to the chest of a casualty who has suffered an SCA, sudden cardiac arrest. An AED can be found in public places around the UK and are registered to be easily found online or by emergency services. If a first aider can find a local AED and has the training to use it, it can be operated in the following manner. Power it up. Simple prompts appear on the device for guidance. Place it near the head of the casualty and turn it on. Some of them automatically power up when lifted from their storage area. Apply the pads. Expose and dry the chest of the casualty, then apply the pads to the bare skin. One pad should be on the right side below the neck, with the other lower down on the left. Clear and shock. No one should be touching the casualty at this point. The AED will prompt the user when it is ready to deliver a shock. Before pressing the shock button, check the area and shout, "Everybody clear," then apply the measured shock. The AED will continue to prompt the user and monitor the rhythm of the casualty's heart. It may action further shocks, but follow all prompts until an ambulance arrives. Rescuing someone from water and fire. Making the accident place safe. When rescuing someone from drowning or burning, you must always think of your own safety as well. Remember, this isn't being selfish, but practical and is for everybody's safety. With water rescue, remember these points if you spot a casualty in trouble. Try to resist the temptation to dive in. You won't know the status of the water or currents. Shout instructions and encouragement from the shore. Throw a flotation aid or life ring to them, if possible. Try to reach them with a branch or stick, and lie on your front when extending it. If you have to enter the water, wade in to chest height, if possible. Get the casualty to dry land and perform first aid. With fire, remember these points. No matter how good your intentions are, never go back into a burning building unless an official gives the all-clear signal. Help with evacuation and direct emergency services to anyone you suspect is trapped. Help with first aid as appropriate. Break the contact with electricity. When attempting to rescue a casualty from electrocution, it is imperative that you are sure they are no longer in contact with the source. This will impact everybody's safety in the immediate area. Try to follow these guidelines. Look for physical evidence of electricity, sparking cables, and so on. Check to see if there is physical contact between the casualty and the suspected source. Look for the source of local power, generator, pylon, and so on. If it can be manually turned off, then do so. If you cannot turn off the power or move the casualty without risk to yourself, call emergency services and wait. Record keeping. As required by UK regulations RIDA, a trained first aider should record the essential details regarding any serious accident and pass that information on to emergency services when they arrive. This information must include the date, time, and place of the incident, the name of the casualty and any known medical conditions, the details of the injury or illness, the name and details of the first aider, the first aid treatment administered to the casualty, what happened to the casualty up to the point emergency services arrived. Within workplace property, this should also be recorded in the company accident book. Summary. In this module, you have learned that there are many varieties of basic first aid techniques that can prevent further injury. The chain of survival is a crucial process that can help extend the life expectancy of a casualty. There are essential pieces of equipment and material that must always be available in a first aid kit. There are specific ways to make temporary slings and dressings to support and protect injuries. You can use CPR or an AED to help resuscitate a casualty. When performing a rescue from water or fire or electricity, you should put yourself in as little danger as possible.